Hi everyone. Good afternoon. Today I'm with Dr. Lai Boon Ping
I
to talk about the cornea refractive surgery. If you have any question, just ask us in the comment below. At the end of the session, we will answer your questions. And then please like and share this live session to your friends and family so that they know whether they are suitable candidates for Lasik surgery, which is also known as corneal refractive surgery. So if anything you want to ask, just uh, comment your questions below and then we will answer the questions. Okay. So we will proceed with Dr. Lai Boon Ping.
thank you, Erin. And welcome all to our Facebook Live today. My name is Dr. Lai Wunpei. I'm the consultant cataract and refractive surgeon for KPJ Central Foresight. I would like to share with you my experience on the cornea refractive surgery. I'm sure some of you are wearing glasses or contact lens, and you wish to carry all your glasses, for convenience sake, So let me share with you, Can start now, can So, so before we start on refractive surgery, So let me discuss something on the refractive error, So what is refractive error, refractive error means our eye is not focus the light properly sharp on retina. Yeah. So there are few type of refractive error. The commoner is short-sightedness. It means see far is not clear, but see near is okay. And the other one is a long-sightedness. Mean see near is not clear, far is okay usually. And third one will be astigmatism. So astigmatism means there's too many focus point in our retina, so you cannot see the image clearly. Usually far and near is not clear. And the last one is presbyopia, or in Malay we call it labuntua. So reading problem when we are old. So next one. So let me show you the diagram on the eyeball. So the most left picture showing the eyeball with the light, the yellow color line is the light. So when we see things, when the light enter our eye, it will focus sharp on our retina. So this is called ametropia or normal eye. If the focus point is focused in front of the retina, we call it myopia or short-sightedness. This can be due to the long eyeball or other cause. Yeah. If the focal point is focused behind the retina, we call it hypermetropia or long-sightedness. And if there are two or more focus points, then we call it astigmatism. So how to correct this refractive error? So the simple way is wearing glasses, or some of us may wear contact lens. Of course, if we are not keen to wear glasses or contact lens, then we can do refractive surgery. We can do a surgery on the cornea or on the lens in the eyeball. So today our topic mainly concentrate on the cornea refractive surgery. It may be doing surgery on the cornea. Let me go to the next slide. Same thing, I'm showing the diagram again. So now go to the third one, the third row. You can see myopia or short-sightedness. So again, this diagram showing you the light is focused in front of the retina. So how to correct this? So the simple way is by wearing glasses. So we wear a concave glasses or short-sightedness glasses, so the light will be pushed back to the retina. Same thing with the long-sightedness, the light is focused behind the retina, So by wearing convex, now is convex cepung, kanda cepung. So the light will be brought forward onto the retina so we can see clearly. So by wearing glasses, either concave or convex, we can change the focus point, either in front or behind the retina. So in the same thing, we can do a surgery on this layer, the front part of the eyeball, we call it cornea. So we can change the shape of this cornea to make it flat, as if there's a glasses onto the front surface of the eye. Then we push back the focus point back to the retina. Same thing, we can change the shape of the cornea by changing the curvature, make it more curved forward. So to bring forward the focus point back to the retina. This is what we do in laser. So what are the type of refractive surgery in our center? Yeah. So we divide the type of surgeries to generation. First generation, second generation, and third generation. The first generation is the older type. Yeah. We call it ASA, or advanced surface abrasion. The commonest procedure done is PRK, photo refractive keratectomy. Yeah, I will explain more after this. So the second generation is we create a flat. Yeah, by doing laser. Yeah, it's called Lasik. Yeah, laser assisted in situ keratomycosis or Lasik. Yeah, there are two types. One is microkeratom. The other one is femtosecond Lasik. Yeah. And the latest one, third generation, is lymphatic lenticular extraction or small incision lenticular extraction, LILESMA. Yeah, this is the latest one. There's no flap created. Yeah, we just straight away laser on deep inside the cornea. I'll show you the slide. So let's go to the first one first, ASA, a one surface abrasion. So in ASA, what we do, so this is the front part of the eye, we call it cornea. So in ASA, first we remove the first layer of the cornea, we call it epithelium, by scraping with a knife. Yeah, and then we apply the laser directly onto the cornea to change the shape of the cornea. So after the surgery, we will put a bandage contact lens onto the cornea for at least a week for comfort. So this is called ASA. Yeah. So basically ASA means we laser straight onto the surface of the cornea. Second one will be the microkeratom Lasik. Yeah, microkeratom Lasik. Yeah. So in this Lasik, we need to create a flap. Yeah. It means we open up the cornea, making a flap by cutting with a blade. Yeah. So you can see. So we use a blade. We call it microkeratom blade. Yeah. So this blade is controlled by the machine. Yeah. So the machine will slice through the front part of the cornea to create a flap. Yeah. Then we remove the flap. Not really remove. We place the flap at the side. We open up the cornea, and then we laser straight on the cornea. So after lasering, we clean the surgical bed. Then we put back the flap. Yeah. There's no bandage contact lens, and patient feel more comfortable. Yeah. So this is the second type, microkeratom Lasik. Yeah. Instead of using blade, we can use laser to create the flap. Yeah. So this what femtosecond Lasik is doing. Yeah. So again, the same thing. We need to create a flap. So we use the first laser or femtosecond laser to create the flap. Yeah. And then we push aside the flap and we laser straight onto the cornea. This laser is examined. So in this procedure, we use two types of laser. First one is a femtosecond laser. The second one is an excimer laser. Same thing. After the laser, we put back the flag. Yeah. So this procedure is almost similar with microkeratome. The only thing we use the laser to create the flag. So in microkeratome, we use the blade to create the flag. Yeah. Both are done by the same laser, excimer laser, to change the shape of the cornea. And now we go to the third one, the third generation or new type of laser. We call it Lilasma. Yeah. So in Lilasma, we don't create a flag, and we do laser on the superficial surface on the cornea. We laser straight on deep inside the cornea. So we laser, there's no flag. So after lasering, we create a small wound at the side, quite a tiny wound, and we use the forceps to remove the tissue or lenticule to change the shape. So after the laser, you can see there's no flag. They only have a tiny small wound at the side. Yeah. So patient feel more comfortable for this type of laser. So I have discussed four types of laser. Now I think most audience will be interested to see whether you are the good candidate for cornea refractive surgery. Yeah. So what are the criteria? So the first one, your eye must be healthy. Yeah. So the eyes must be healthy. Eye doctor or ophthalmology will examine your cornea, yeah, and the whole eyeball. The cornea must be okay, normal. There's no scar, no other diseases like keratoconus. Yeah, and internally, there must be normal eye. The retina is healthy. There's no cataract, no glaucoma, no ocular inflammation, and or other eye diseases. Yeah, so the eye must be healthy. Second thing, yeah, as you see just now, in Lasik, we are cutting away some tissue from the cornea. So the remaining cornea must be thick enough to sustain the intraocular pressure. Yeah. So the cornea might have some optimal thickness. Yeah. So as general rule, we will measure. There's a machine to measure the cornea thickness. Yeah. The cornea thickness to start off, we have to be above 500 micrometer. If the cornea is too thin, you may not be able to proceed for surgery. Yeah. And the second thing, after cutting, we have to measure again, we have to predict what the residual central cornea thickness. Preferably, the safe zone is above 250 micrometer. Yeah. Less than that, we cannot proceed for laser. Yeah. And the third thing, the pupil must not be overly large. Pupil means the black eye. Because in laser, when we do laser, yeah, let's see, yeah, we don't cut the whole cornea. Usually, most of the time, we cut the central 60 or 65 or something 70% of the central cornea. So the remaining side rim is not touched. So if the pupil is larger than the treatment zone, mean the larger than a 6 or 7 mm, then you may have a lot of visual disturbance at the night, usually, like glare and halo. So we have measured the pupil. The pupil cannot be too large. Yeah, preferably less than 6 mm. Yeah, and the fourth one is the power or the glasses prescription. Yeah, it cannot be too high actually. It also depend on the machine. Yeah, depend on the Lasik machine and also depend on the cornea thickness. So as a general rule, for short-sightedness, the power cannot be more than 1400 or 14,000 or 1400. Yeah. For long-sightedness, it must be below 800 or 8,000. And astigmatism, it must be below 600 or 6,000. Yeah. Anything larger than this measurement of power, we cannot proceed for laser. Yeah. How about age? Yeah. Sorry. Go back. Okay. For age, usually we do laser only for patient above 18 years old. Too young, we don't do laser because it's not stable yet. Yeah. So we need to wait for the power to be stable. So 18 years old. Any upper limit? In fact, there's no upper limit. But as general, we don't really do LASIK in old people. Yeah. In many people, in old people, the length is changing. It may change the power. The power is not stable. Yeah. So usually less than 50 years old. Uh, if you are older than 50, usually we don't do this. We do cataract surgery or clear lens extraction. Yeah. And the sixth one is the power. So the power of the glasses or contact lens must be stable for at least 2 years. So it must be stable. If we keep changing, then we have to wait. Yeah. We have to wait until the power is stable. Yeah. For at least 2 years. Yeah. And the seven will be you must be in good health. So systematically you must not have other diseases, yeah, especially like autoimmune diseases, yeah, like SLE, all this, yeah, because it can affect the power of the glasses, yeah. The eighth one is the for lady means pregnancy, yeah. So if you are pregnant, then we cannot do laser, yeah, because pregnancy itself can induce hormonal changes. When there's a hormonal changes, the power may change. Yeah. So we only do it after delivery. Yeah. And wait for the power to stabilize. We only proceed for laser. For the last one is you must not have very high realistic expectation. Yeah. Yeah. Of course, no all laser is 100%. We can achieve the target. Yeah. So depending on the type of the laser and also the the power. So I must say is about 90 to 95%. Yeah, accuracy. Yeah, roughly 5 to 10% after laser. Sometimes the power will drift off or regress. Then if the power run off is too high and if patient is not certified, then we can do a touch-up laser. We can do second time, no problem, to fine-tune the residual power. Yeah. So these are the criteria we do laser. Yeah. So for those who are interested on doing laser, uh, if you're healthy, your power stable, you're quite motivated, you want to carry your glasses, then we can examine for you. Yeah. So now I show you some video clip to show you how we do laser. So the first one is the ASA. So in PRK, we need to soften the first layer first, epithelium, yeah, by using alcohol, yeah, for about 30 seconds to soften. So for easy for the surgeon to remove the epithelium. Yeah. So later we apply the laser, yeah, onto the corneal bed, yeah, yeah. So if depend on the power, roughly it take roughly 20 to 30 seconds usually. Yeah. So later we apply a bandage container as the wound is quite large. There's no flap to cover the wound, so it's quite painful after surgery. So we apply a bandage contact for at least a week. Yeah. So this is called ASA. So now we go to microkeratome Lasik. So this one we are using the knife to cut. Yeah. So I show you the video clip. So sorry, this video can have no sound. So I just explain to you. So we're using the microkeratome system. So you can see there's a plate here actually. So then we will first we will apply the suction here. It's a vacuum suction to stabilize the group, the eyeball. Then we will run the machine. Yeah, it's automated. So this blade will cut through the cornea, the front part. So After cutting, we push the flat to the side, and then we apply the excimer laser to change the shape of the cornea. Yeah. So same thing. This take about 20 to 30 seconds. Then we put back the flap. So in this procedure, there's a flap to cover the wound. Yeah. So patient feel more comfortable. By next day, usually they have some achieve some good vision usually by next day. Yeah. So this is microkeraton Lasik. So now we proceed to the femtosecond Lasik. Yeah. This Lasik is almost similar to microkeraton. The only difference is we're using the laser, the femtosecond laser, to create the flap. Yeah. So let me show you. Okay. So same thing. We apply the femtosecond laser. Oh, it's not play. Okay. Play. Okay. Okay. So you can see the three procedure I show you are using the same laser, excimer laser. So they all are the same. Yeah, when we using the same laser. The only difference is one have no flat, one have the flat, and the way we create the flat. Yeah. Now we go to the third generation, the latest one, and in this procedure, there's no flat created. Yeah. So you can see in this relasma, so the femtosecond laser is straight away shoot on deep inside the cornea, the deeper layer, bypassing the first layer, the superficial layer. So the superficial is untouched. We laser straight on deep into the cornea. But how to take out this tissue, which we want to throw away? So we create a small wound here at the side. Yeah. Run the video again. So this is relasma. Yeah. Yeah. The small is smaller. There's no flap. Yeah. So again, I show you the diagram. What are the differences between all the method? Yeah. So in PRK or ASA, we laser straight on the superficial part of the cornea, and after surgery, there's no flap. Yeah. For LASIK, we create a flap and we laser on the deep cornea and put back the flap. And is in SMILE, we don't create a flap, we laser deep inside the cornea. So they are the different. Yeah. So as conclusion, uh, reflective surgery may be good option for you if you want to decrease your dependence on glasses or contact lens, and your eye is normal, and you're quite healthy, and you're quite motivated. Yeah. And also the reflective power is in the range of the laser. Yeah, may not be too high. Yeah. So with that, I thank you uh, for your attention. Yeah.
Okay, so here's doctor. We got one question.
So we answer.
It's a Q&A session. So if you have any questions, you just drop the comments below. So here from Farahain Ibrahim, is there any warranty for Lasik and how long does it take to fully recover?
Okay. Yeah.
Warranty.
So in any LASIK, there's two wound to consider. One is the flat, the superficial wound. Yeah. Uh, so this wound usually will take 1 month to heal completely. So after laser, you cannot rub the eye, do it embark on any strenuous exercise, no rubbing, no sport, no swimming, all this. Yeah, not applying any makeup for at least a month. Yeah, this is an external wound. Inside the another wound, you call it the internal wound, the laser bed, the true laser wound. Yeah, this one will take 3 to 6 months to stabilize. It means the power may stabilize in 3 to 6 months. Yeah, so so for external wound it take 1 month to heal, and the internal wound may take 3 to 6 months to stabilize. And usually after let's say the success rate is roughly 90 to 95%. Yeah, suppose the power run off because of certain reason, and most eye doctor will wait for at least 3 to 6 months to wait for the power to stabilize. Any residual power which you are not happy, then usually will proceed for touch up. We can do again touch up. Yeah. So in our center, we will do a touch up. We give a free touch up, free of charge for at least for a year actually. Yeah, for 1 year. Yeah.
So that's another question. So what is the pre-op? I mean before you want to do LASIK, so what you have to do? I mean for the assessment.
So pre-op is quite simple. For those who are wearing glasses, for you don't have to do anything. You just come to our clinic. We do a proper assessment. Yeah. The eye doctor will examine the whole eyeball. Yeah, from the front up to the back, and we do some measurements, see whether you are a good candidate. But for those who are wearing contact lens, yeah, for wearing contact lens, we advise at least you off your contact lens at least 2 days, yeah, 2 days. Of course, the longer is better. 2 days before contact, then you come to our clinic. Then we take out your contact, we do the power checking. Yeah. So for surgery itself, if you're already listed for surgery, then we advise to off the contact lens for at least 2 to 3 weeks, yeah, before the surgery. Yeah.
Okay, so remember contact lens wearer, you have to let off the contact lens before the assessment. Okay, and then okay, there's one question. If I am a pregnant woman, how long must we delay the surgery?
So as long as you are pregnant, we don't do surgery. But after the delivery, the longest we wait for the power to stabilize. Yeah, yeah. I mean confinement. Yeah. Uh, so for at least 6 weeks, within the 6 weeks after delivery, we don't do laser. Yeah. So by second month or third month, we will repeat the power checking again. Yeah. If it's similar with the power before the uh, pregnancy, then we will proceed for surgery. If it's still some changes, the power still change a lot, then we will delay it. Sometimes we may delay up to 3 to 6 months only when the wait for the power to stabilize. Of course, the longer is the better. Yeah.
Okay, if let's say for those patients who cannot do any LASIK at all, so what is the other option?
Yeah. So it depends on your age as well. Yeah. Usually, if you are less than 40 years old and your eye is not suitable for LASIK, then we can do other procedure. We call it phakic implant. Phakic implant means we insert a lens, intraocular lens, something like our contact lens. Actually, it's not really a contact lens. We put inside the eye. Yeah, we call it phakic implant. Uh, it can be like ICL or IPCL. It's a special type of contact lens. It's similar like contact lens, but it's not really a contact lens. We put inside the eye, behind the pupil. So behind the iris, in front of the lens. the small tiny space we call sulcus, we insert the lens. So after the procedure, you have two lenses. One is the original natural lens, and the other one is the artificial lens to create power reflective power. For those who are above 40 years old, because above 40 years old, you may have some reading difficulty. Then we can do clear lens extraction. We take out the internal lens, the lens. We put another lens inside. Usually we put multifocal lens, yeah, to correct the reflective power. So with the multifocal inside the eye, we can see far and near without glasses, yeah. So we can do phakic implant for those who are less than 40 years old. Above 40 years old, we may consider clear lens extraction with a multifocal intraocular lens implant.
Okay, and then another question. Maybe you already said before, but uh, the age for those who insist to do the lesson,
Yeah.
the
So for
suitable
most of
age.
the time, we wait until 18 years old. Yeah. Too young, we may not consider because the power still increase because the eyeball still growing. So 18 years old is not really a cutoff point actually, but as general, most of us will take 18. Some surgeon will take 21 years old, some, but 18 is a general. Of course, we got some patient younger bit like 17, 16, still insisted to do, then we consider case to case basis. Yeah. But and the other thing we look into is the power must be stable. It means 18 years old you want to do, at least by 16 years old to 18 years old, there's no change of the power. Uh, If the at 18 years old, the power is quite different from the 17 years old, then we cannot proceed as well. You have to wait for it to stabilize. And for the upper limit, there's no upper limit. We can do let's say at the age of 50, 60, 70. But provided the intraocular structure is normal, at least uh, usually I mean lens cataract. Usually old people will tend to have cataract. This may change the power. And if there's a cataract, usually we don't do LASIK. We do cataract surgery to put a multifocal implant instead of LASIK. Yeah. But if there's no cataract and patient insisted to do let's say above 50, we still can do actually. But usually this our age group we don't do full correction for both eye. One eye we do full correction, the other eye usually we under correct to leave some residual short sightedness. At least patient can see near. Yeah. So for above 50, usually we don't really do full correction. One eye we do full, the other eye we under correct it.
Okay, here, okay. Can we fly after refractive surgery?
No problem. You can fly. No problem. Yeah, you can fly. Yeah, yeah. It would affect the cornea wound actually. Yeah, no problem.
Now, this is the most frequent questions. How long will the LASIK last?
Yeah. So let's say actually it's meant to last forever actually. Yeah. So the younger you do, then you can enjoy classes free. Yeah. If you're quite already like 40, 50 years old, you may not enjoy classes free, mainly because you have presbyopia, labuntua. So above 45 like that, above 45 you have problem seeing near actually. So this LASIK is not to correct near, to correct far usually. But 40 when you reach 45, you have problem senior, so you still need to wear reading glasses. Yeah. So LASIK does not correct presbyopia or lapuntua. You only correct for distance. Yeah. So when you reach 40, above 45, you still need to wear glasses. Yeah.
I think so far that's all for the questions. So if let's say you still have any questions, just DM us or we will provide the number for you to ask any questions. So now, by the way, thank you, doctor.
Thank
Thank
you. Yeah,
you.
yeah. Thank
So
you.
thank you
Yeah,
so
yeah,
much
yeah.
to
Thank you
explain
for
further
listening.
on the
Yeah.
LASIK procedure and everything. So now we actually are having a Lasik offer, which is only 100 ringgit. You can book 100 ringgit. Just call our center or DM us. We will give you the details about this offer. So this offer is from 6th of December until 30th of December. So quickly grab this offer because it's 100 ringgit. We will check your eye whether you are suitable or not for LASIK. It is very affordable price for you to check the eye. So thank you so much,
Yeah, thank you.
doctor.
Yeah,
So we'll
thank you.
see
Yeah,
maybe in the next
yeah, yeah.
session.
Thank you. Yeah.
Thank you.